Well, you know what? It is a club no one wants to be part of, but 1 in 8 women in the U.S. will develop breast cancer in her lifetime. That is scary. The majority of these women also don't have a family history. That's why prioritizing your health is so important. Board-certified breast radiologist Dr. Michelle Agrons with Memorial Hermann is joining me now to have this great conversation. Dr. Agrons, welcome to the show. Thanks so much for being here.
Thank you, Courtney. Thank you for having me. It's an honor to be here.
Absolutely. Let's first talk about the importance of mammograms. I think some people hear this and it might be some white noise. We understand, we know that we should get these screenings, but this is so important. This is the key to early detection.
That's correct, Courtney. And like you said, 1 in 8 women in this country will have breast cancer sometime in their life. And these women will not, most of them will not have a family history of breast cancer or even present with symptoms. So screening mammograms is where we detect these cancers. Additionally, breast cancer is the leading cancer to affect women in the United States and a second leading cause of cancer death. So the screening mammogram is so important. It's been shown to be the best tool that we have to diagnose cancer at an early stage when cancer is the most treatable. It's also at the time when breast cancer-related death can be avoided and the numbers reduced the most.
Absolutely. As you said, mammograms save lives. This is also having this yearly screening gives us a baseline as we women, as we age and do this every year. It's an effective way to stay on top of our health. Let's talk about the specifics. Who should get their mammogram?
Okay, and that's a great question. I'm glad you asked. So health experts recommend that all women with average risk of breast cancer get a screening mammogram beginning at age 40 and get an annual mammogram thereafter. These are women regardless of their family history, regardless of any symptoms. Additionally, there will be women who are at higher risk of breast cancer, like women who do have family histories or other genetic situations. And those are women who should speak to their healthcare provider and schedule their screening accordingly, which will probably be earlier than the women who are at average risk. Also, certainly if a woman has unusual symptoms, even if she's between screening mammograms, say you're on track with your yearly mammograms and you have some unusual symptoms in between, such as unusual or focal breast pain, a palpable finding in your breast or in your underneath your arm, a lump, or any type of skin changes, nipple discharge, especially if it's clear or bloody. All of those things should prompt a woman to speak to her healthcare provider and come in to get imaging as soon as possible.
Absolutely. Pay attention to our bodies. We know it best. The process, too, doctor, is very easy. Some women may think, oh, I'm nervous. I hear it hurts. All of these things. Let's talk about the process, because as soon as you're in there, it's almost as soon as you're out. It's very quick.
Yeah, that's a great thing. So they are anxiety-provoking mammograms and waiting for the results, and that's normal. It's okay to be concerned. What we do here at Memorial Hermann is the best that we can to keep people as comfortable throughout the process. We have very well-trained technicians, state-of-the-art technology. We can get diagnostic imaging very quickly so that the patient can be in and out fairly quickly. We try to keep people as comfortable as possible. And then as radiologists, we try to read the studies within a reasonable amount of time so that most patients have answers within a few days.
And this is also, doctor, a great time to schedule your mammogram as we are celebrating Women's Health Week. So here's your soapbox. Tell everybody that they need to go out and get screened.
Almost definitely. I would love to have this opportunity to tell women, please make this a priority. Make your health a priority. Schedule your screening mammogram. Make sure you stay on top of it once a year. This is how we detect cancers early. This is how we are able to treat cancer and reduce the morbidity and mortality that's related to breast cancer for you and for all of those around you.
Early detection saves lives, as we have said. Michelle Agrons, thank you so much for being with us today. We do appreciate it.
Thank you for having me.
Absolutely. To schedule a mammogram or to learn more, you can visit memorialhermann.org/mammo or give them a call, 877-40-MAMMO. By the way, if you've already had your screening this year, reach out to your bestie, your neighbor, your cousin, and ask them if they've had theirs.